The word euthanasia comes from the Greek language, eu meaning good and thanatos meaning death. Euthanasia is the act or practice of painlessly allowing an individual to depart from life at their request. This process gives those who are suffering severe pain a chance to be relieved in a simple, painless way instead of suffering day in and day out. This process provides a good death. Most people depart from this life in what would be described as a bad death. Patients can experience suffering from anywhere from days to even years. They are forced to endure this pain and come to terms with the fact that their life on earth is ending. Every individual has the right to decide what will happen to his or her own bodies. We should have the right to choose the fate of our lives and request help in any path we choose to take. Allowing the person to depart from life is a compassionate way to relieve their suffering. Even though euthanasia is illegal, it still takes place all around the world. No matter what, this will always be true. It would be better for it to be legal and controlled than illegal and out of control. Some individuals have the option of ending their lives on earth by refusing medical treatment. Some don't have this option. They should be allowed to choose to expire peacefully rather than painfully. Studies have shown that most people in North America support the right to choose the path of our lives. In 1995, a poll showed that 75% of Canadians support helping these people pass on peacefully. In 1997, 96% were in favor. This number increased to 77% in 1998. A poll at speakout.com shows that 67% of people are strongly in favor, while only 30% are opposed and 4% are undecided. Both of these surveys show that the majority of people are in favor of euthanasia. First, these people agree that every individual should have the ability to choose their own fate. Second, they agree that euthanasia should be an option for a simple, painless way to leave the earth. They also understand that euthanasia will occur whether it is legal or illegal. And finally, they believe that those who do not have the opportunity of departing by refusing medication should have the option of euthanasia for a painless solution.
Okay, that was 2 minutes and 48 seconds.
Solid.
Enroll.
Euthanasia is a practice commonly called mercy killing. It is the intentional termination of a human life. Many times patients suffering from terminal illnesses may request for assistance in an unnatural death to let them be free from their pain that they are enduring every day that they are alive. However, these patients who wish to die often have clouded judgment due to medications that they are taking or whatever pain they may be experiencing. In fact, studies show that out of all the people who wish to have an assisted suicide, those who don't, within a 5-year period, have lost all desire to be terminated. There are many options for people who are suffering from terminal illnesses other than physician-assisted suicide. One of these options is the use of more effective pain relief medications. Many patients suffering from these terminal illnesses may resort to euthanasia to relieve their pain that could just as easily be relieved through the use of more effective use of pain relief medications. In fact, it has been proven in studies that in most cases, the use of pain relief medication has been a viable option, but a neglected one. Another option is the use of therapy for people who have had traumatic experiences and wish to die through euthanasia for reasons beyond pain relief. These people usually have women. These people have issues that are unresolved and do not wish to let them linger over their head before they die. Therapy has been proven to be an effective and very useful technique in helping these people get through their last and dying moments, and is often a neglected option when they are presented. One more option for those who are suffering is hospice care. Hospice care is, the Hospice Alliance is an organization who try to make people's last dying years and weeks as comfortable and as painless as possible. Organizations such as these are very effective and have been widely used throughout the world. Their basic intent is to ease people into a natural death without resorting to assisted suicide. Many sick and dying people throughout the world have resorted to euthanasia. It should not be legalized, and it should not be the primary use for those who are in pain.
Okay.
Main point of my speech today is to prove that euthanasia is a misconceived practice. Death with dignity has become the catchphrase of most pro-euthanasia people, and that's a very misconceived, or leads to many misconceptions about euthanasia. The truth is, most of Dr. Kevorkian's victims were killed in their garages by carbon monoxide poisoning. And the majority of those victims were then dumped in their car and brought to a parking lot of local supermarkets or stores to be discovered sometimes weeks later. And this is kind of a contradiction to the being surrounded by loved ones that these people will let you think. Other people have come up with, other people are killed by the use of lethal injection, which often causes such horrible convulsions in the dying that the loved ones can't even survive or don't even want to be there when their loved one is killed. And they could be there in a hospital environment to watch their loved one die peacefully. Philip Niche, a pro-euthanasia person, has developed a computer program which will provide the injection on its own, so no one has to be present at the time, so no one has to witness the horrible convulsions that the person goes through. Another problem with, or another misconception that people have is that euthanasia will help control healthcare costs. That's true, but it'll also possibly lead to doctors using euthanasia as a way to keep healthcare costs down instead of paying for the costly care that they'd have to do for several years to a person dying of cancer. Instead, they can just kill this person a few weeks into the disease, and they don't have to worry about paying for this person and going through all the red tape that would otherwise be necessary. Another interesting thing about euthanasia is that 70% of the people that are killed are women, which could be considered evidence of a hormonal imbalance that could lead into people choosing suicide and death, rather than it being a true medical condition, although there's no evidence that it's true. So I hope this has kind of showed you what the misconceptions are about euthanasia, and I hope it will help you on euthanasia with their eyes.
Okay, 2 minutes and 38 seconds.
Euthanasia in any form should not be legalized. It would be impossible to regulate the extent and purpose for which it is used. Once the government opened the door for a derivative of euthanasia, all types of physician-assisted suicide would be that much closer to entering our society. An example of this is with the Netherlands, where in 1981, assisting the suicide of a terminally ill patient was legalized. The following year, the killing of an elderly person in bad health was permitted. 2 years later, the Dutch Supreme Court ruled that people suffering from disabilities could be killed. In 1989, it was extended to include children born with Down syndrome, and in 1994 to women suffering from depression. The recently released Remlink report revealed that in the Netherlands in 1991 alone, 2,700 people killed were killed by doctors upon their request. An average of 3 people a day were intentionally killed by a doctor's actions who had never requested euthanasia. Of these, 72% did not express a desire to die, and 14% were completely competent of leading a normal life. 8,100 patients died when doctors prescribed overdoses of pain medication to hasten their deaths. These actions were not discussed with 61% of them, and 27% were fully competent. In total, in 1 year, Dutch physicians intentionally caused the death of 11,800 people. The patients did not request more than half of these deaths. All of this in a country where, technically speaking, euthanasia remains illegal. In fact, the only place where the law specifically allows a doctor to prescribe lethal drugs to kill someone is in Oregon. Since its legalization has provided a quick and easy way out for many people. In 2000, of the patients who requested euthanasia from their doctor, only 19% were referred to psychologists, and on average they were killed within 30 days. In 1809, Thomas Jefferson wrote, "The care of human life and happiness, and not their destruction, is the first and only legitimate object of good government." Debates over euthanasia are currently being held in Oregon as well as in the Supreme Court. Both the Clinton and Bush administrations oppose this practice, as well as the DEA. After seeing the erratic effect it had on the Netherlands, many experts in the field, as well as 65% of the American public, object to the admission of euthanasia in any form.
240. Any?
Most people believe that the majority of society agrees with physician-assisted suicide, also known as PAS, or voluntary active euthanasia, known as VAE. However, the latest polls have shown that this is a misconception. 50% of the people surveyed about PAS and VAE did not believe that it should be legalized. In this survey, it was also discovered that the older respondents were more likely to disagree with physician-assisted suicide, or voluntary active euthanasia. M. Pel Lawton, PhD and senior research scientist at the Keleher Institute of the Philadelphia Geriatric Center, says that the older respondents are more willing to adapt or accept an illness or disability, which makes them more accepting to death. In March 2000, there was a nationwide poll that asked, if you had a disease that was fatal and was causing great pain and discomfort, which of the following courses of action would you prefer? 1. Physician-assisted suicide. 2. Wait and let nature take its course. Or 3. Not sure. All of the respondents of this poll were at least 18 years of age. Only 30.4% said that physician-assisted suicide was their preference. 6.1% said they were unsure, and a much larger 63.5% said they would rather let nature take its course. Many people that support PAS or VAE also agree that the physician's prediction on the longevity of one's life is accurate. However, the physician's estimate is often wrong. One of the many examples is a young man that was paralyzed at the age of 21 and was told by his physician that the typical lifespan of a male quadriplegic was 36 years. That meant he only had 15 years to live. At the age of 45, 24 years after he was faced with being paralyzed, he is still alive and is thankful that neither PAS nor VAE are legalized. He says that there are always those hard times in which he would seriously contemplate about choosing such an option as physician-assisted suicide, without thinking about the future and how great it could still be for him. A poll given amongst people nationwide also revealed that people are not as afraid of death as they are of being in pain at the end of their life. This is one of the largest arguments for physician-assisted suicide and voluntary active euthanasia. This pain can usually be stopped with the use of prescription painkillers that doctors try not to prescribe to their patients because there's a risk of these terminally ill or disabled people becoming addicted. This is so absurd that George Boaklis, PhD, psychotherapist, and author of Psychotherapy with the Elderly, says that he's heard of doctors not wanting to risk the addiction of a 90-year-old woman to morphine. This proves that the legalization of physician-assisted suicide and voluntary active euthanasia is not what our society wants nor needs.
2 minutes and 59 seconds.
Yeah.
Now that is some serious precision.
You're right.
Euthanasia. You may have heard this word in recent months, as it is currently a highly debated topic in America. Euthanasia is described as a means of ending someone's life before they can die naturally. It is also known as mercy killing. Most people believe that euthanasia and assisted suicide are the same thing. But in reality, they are very different. Euthanasia is the actual killing of another human being, while assisted suicide is merely providing someone the means of killing themselves. A term often used is the doctor is loading the gun, but the patient is pulling the trigger. These hold up as very different cases in our nation's courts. In most cases, euthanasia is used as a way of putting terminally ill people out of their suffering. Activists for the freedom to end one's own life feel that people who suffer through every day should not have to keep living a painful life. At the present time, the only place in the United States where euthanasia is legal is the state of Oregon. Oregon instated the Death with Dignity Act in 1994. It classifies a fatal overdose of medicine as proper treatment for a doctor to prescribe a patient. With this act, Oregon became the first place in the world to give doctors the power to prescribe lethal medication used for ending a patient's life. It is also practiced highly in the Netherlands, but is technically illegal. Some believe that a request for assisted suicide is just a call for help and can be treated by counseling and support. Statistics show that only 4% of people who attempt suicide will commit suicide after that. But the people eligible for euthanasia aren't just depressed. They aren't just frustrated. These are people who know that their lives are coming to a close. They also know that their last days alive will be spent suffering in a hospital bed, weak, scared, and afraid. If these people are not helped, they may resort to painful ways of suicide instead of dying peacefully with their family and friends at their homes. The Constitution gives everyone in the United States a right to life, and they should also have the right to death. Thank you.
Good morning. We'll be doing that tomorrow. We'll be starting that tomorrow. Actually, we might start it today.
Euthanasia is defined as the intentional termination of life by another at the explicit request of the person who dies. The term euthanasia normally implies that the act of killing must be started by the person who wishes to commit suicide. There are many different outlooks and arguments on the issue of whether or not euthanasia should be legalized. One main point of view is the religious aspect. There are two main arguments made by Christians, which advise against an individual seeking suicide. First, they plead that life is a gift from God, and that each individual is its steward. Thus, only God can start a life, and only God should be able to end one. According to Christians, an individual who commits suicide is committing a sin. Secondly, Christians believe that God does not send us any experience that we cannot handle, and God supports people in suffering. To actively seek an end to one's life would represent a lack of trust in God's promise. The Roman Catholic Church typically shares the same beliefs as Christians in that they do not support euthanasia or doctor-assisted suicide. Roman Catholics believe, and I quote, "Everyone is responsible for his life before God, who has given it to him. It is God who remains the sovereign master of life. We preserve it for his honor and the salvation of our souls. We are stewards, not owners, of the life God has entrusted to us. It is not ours to dispose of." End quote. On the other hand, there are many religions, including atheists, humanists, non-Christians, and liberal Christians, who do not accept these theologically based arguments. These religions might argue that each person has autonomy over their own life. People whose quality of life is non-existent should have the right to decide to commit suicide and seek help from euthanasia. In addition, they also believe that sometimes a terminal illness is so painful that it causes life to be an unbearable burden, and death can represent a relief of intolerable pain. This topic of euthanasia continues to be a very controversial issue, and
Okay, do we hear any signpost language in that one?
One extremely important thing to consider about assisted suicide is what the possible consequences are if the attempt should fail. Take, for example, the common use of barbiturates for suicide. If the drug fails to work, extreme gasping and muscle spasms become possible. Difficulty in simply taking the drugs can cause problems. Then there is also the possibility of the failure of the drugs to induce unconsciousness, in which case death would take a number of days to occur. In Oregon, where assisted suicide is legal, one unfortunate resident found out exactly what can go wrong the hard way. After this man took drugs, which were intended to end his life, his physical symptoms were so disturbing that his wife forced herself to dial 911. He was then taken to the hospital, where he was revived. Some statistics on assisted suicide complications are as follows. The muscle spasms and extreme gasping, which were mentioned earlier, along with vomiting, occurred in 7% of assisted suicide cases. In 18% of assisted suicides, other problems occurred which caused the doctors to make the decision to use euthanasia. In 14% of assisted suicides, the patients did not become unconscious, awoke, or lingered far longer than was expected. In 1998, a survey conducted by the American Society of Clinical Oncology, or ASCO, found that only 22% of doctors who specialized in cancer treatment supported assisted suicide in terminally ill patients. This was a dramatic decrease from the 45% of oncologists who had supported assisted death just 4 years earlier. The ASCO attributed the drastic change to an expanding amount of knowledge about how to facilitate a good death, which makes euthanasia and assisted suicide no longer necessary or even desirable. Many doctors are opposed to assisted suicide as a result of ethical traditions. The Hippocratic Oath, which all American doctors must take, states the following: "I will not administer poison to anyone where asked, and be of benefit or at least do no harm." In addition, professional groups such as the American Medical Association oppose assisted death. Their main concern is that assisted suicide, especially physician-assisted suicide, could damage the public's image of the medical profession, and in particular that of doctor in the role as healer.
Okay, that was, whenever you start, I'll hit the button.
People who want to die are not asking much of us. Their life belongs to them. The idea that we think we can impede upon this fundamental right is laughable. We don't tell women that they cannot vote. It's in our Constitution. The Constitution protects against such measures. We honor that. Picture this. Your parents bring you to a restaurant. You order, you're waited on, and you receive the wrong food. Upon asking to send it back, the waiter tells you not only must you eat and clean your plate, but you must pay full price for the meal. This is not that far from the reality of laws preventing euthanasia and doctor-assisted suicide. I strongly believe from the time of conception to death, not only does someone have a right to death, but also a right to life. Although choosing death is not the right decision for everyone, it is necessary for those patients who feel they cannot continue. In the 1891 Supreme Court case of Botsford versus the Union Pacific Railroad, it was ruled that all people have the right to be left alone. These words must continue to resound today, for it is the glue that holds our country together. That's my speech.
Okay, that was 128.
A little short. Came up a little shy.
Before a doctor can relieve someone of their extreme suffering by hastening their death, there are a lot of questions the doctor must ask and qualifications that the patient must meet. First, the doctor should wonder, why does this person want to die? Are they experiencing extreme physical pain? Up to 35% of patients enrolled in hospice care describe their pain as severe in the last week of life. Also, 57% of deaf patients cited loss of dignity as their reason for suicide. They may also be suffering from depression. The doctor should ask, does this patient fully understand their disease, and is their depression reversible? The doctor must ask many specific questions to the patient. What kind of deaths have you experienced in your family? What is your worst case scenario for the rest of your life? What makes you want help with dying, and how long have you thought about this decision? What are some of your symptoms? Are you feeling pain? Are you having family problems? Or maybe they're going through a spiritual crisis, or are they suffering from depression? There are many reasons that a person may want to die. 57% feel that they have lost their independence and they want to end their life because of this. 55% have a very poor quality of life. Only 38% view themselves as a burden to their family, and only 11% felt that they should die because they were a financial burden, and only 6% because of a lack of social support. Most of the reasons people wanted to die were their own personal reasons, such as 54% who felt they were completely ready to die and wanted to end their life. And these statistics came from the physician's experiences with the Oregon Death and Dignity Act from the New England Medical Journal. Marcia Angel, the executive editor of the New England Journal of Medicine, says that the highest ethical imperative of doctors should be to provide care in whatever way best serves the patient's interests, in accord with each patient's wishes, not with a theoretical commitment to preserve life, no matter what the cost is in suffering.
Okay, that.
Life is a precious gift that is to be received from the Creator with gratitude. It should be cherished, preserved, and enhanced in every way possible. But when a person feels their potential for a meaningful, joyful, and desirable life has been exhausted, and every effort has been made to prevent the inevitable, we should make it legally possible for the merciful to show mercy to the dying who request to end their suffering. The word euthanasia originates from the Greek language, eu meaning good, and thanatos meaning death. The term itself means the intentional termination of life by another at the explicit request of the person who dies. Some people who decide that they wish to end their life in the natural world are unable to accomplish this act. They would need assistance from another person, usually a physician. Physician-assisted suicide is currently legal under severe restrictions in the state of Oregon and in the Netherlands. There are many aspects which contribute to the decision by a person to end their natural life. Here are a few examples of the reasons why someone would resort to euthanasia. 1. They live in excessive chronic pain and want a way to escape their pain and suffering. 2. They have a terminal illness and do not wish to diminish their wealth on costly medical expenses as their unavoidable death approaches. They would rather depart from the living world sooner and pass on their assets to their family and friends. 3. A serious disease or disorder has affected their quality of life to the point where they can no longer wish to continue living. 4. They have lost their independence and have been confined to a nursing home, a place where they waste away their